Hi, I'm Dr. Amir Karam, board certified facial plastic surgeon, and I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we are going to take a tour through the beautiful world of Vertical Restore. I'm going to share with you case by case a number of outcomes so you get a chance to see and appreciate what can be done surgically to rejuvenate the face. What we're going to do is we're going to look at patients of all different ages and all different levels of aging and different anatomy so you can see the range that this procedure can perform. Now keep in mind, a lot of these patients have also undergone fat transfer, which is in my opinion, sort of the magic dust that ties the whole picture together, as well as the treatment of the upper eyelids and the lower eyelids and the lip lift when indicated. Many of these patients have also treated their skin with either lasers, and almost all of them have been on the Karam MD Trifecta, which is a skincare product I developed that helps rejuvenate and treats the aging changes of the skin in a very simple 3-step process. So anytime that these changes are part of the overall plan, they will be outlined and listed, but to sit back and enjoy, and I'll give you a little bit of a verbal tour of kind of the basic advantages of this approach.
Let's take a look at our very first patient. Her name is Nicole. She is in her 40s. And when she came to me, she had the basic concerns that her face no longer looked the way it did. She was noticing some changes in her overall shape and that she started to look tired. And specifically when I asked her, she was concerned with the laxity along her jawline and her neck, and she was looking for a permanent and durable solution to these problems as opposed to looking for more or less temporary or partial solutions that can be found with non-surgical treatments. Looking at her on the front view, you can see that there is a generalized change in the oval shape that is consistent with a youthful face. Normally we see a V-shaped jawline, a firm neck, and overall heart shape to the face. And when we look at Nicole in this before photo, you can see there's a significant amount of laxity that looks like it's coming from the top down and getting heavy along the jawline, and of course showing signs of laxity in the neck region. What's happening in addition, you can see that the midface has fallen towards the nose, deepening the nasolabial fold, but also creating a depression in the midface. And this can sometimes be mistaken for volume loss, but it's usually because of the descent of the midface or drooping of the midface. Now, there is definitely volume loss happening simultaneously. You can see around her eyes and her temples. And so what I recommended for Nicole was a vertical restore and a fat transfer. And this was to replace the lost volume, but also to elevate and reposition all of the soft tissue descent that has happened. And you can see here in the after photos what a tremendous change there is to the overall facial shape. You can see this on the front view as a much more defined jawline and V-shape to her face. You can see a fullness that makes her look less tired and more vibrant. And when you look at her on the 3/4 view and profile views, you can really see how that change in jawline and taking up that laxity under her neck has really given her a more feminine, more beautiful, more youthful, all-around configuration. And this is ultimately how Nicole identifies with herself. She feels like a very energetic, high-spirited person, and the path that she was on as a 40-year-old was certainly going to lead to a very distressing and very unidentifiable 50s and 60s and beyond if she did not address these problems directly with the surgical procedures that we recommended. Ultimately, she looks extremely natural, beautiful, and has no evidence of any type of surgical intervention. Next is our beautiful patient, Lizette. She is 54 years old, and her primary concerns were similar to the previous patient in that she started to lose the self-image, the confidence, and overall felt that her facial shape was making her look like a different person. And when you look at her on the front view, you can certainly see that there is a significant change in that youthful V shape that we discuss and what we aim for, which is kind of that heart shape, which is a more fullness up top and a defined jawline and a pristine looking neck. And when you see her on the profile view, you can see that there is a ptosis of her chin, which means that the chin is kind of pointing down. There is a significant amount of droopiness and laxity in her neck. It almost looks like there is a direct continuation from her chin all the way down to her chest without a defined neckline and jawline. And this is very distressing to people because ultimately people want to look as young as they feel. And in Lizette's case, she no longer felt like that youthful spirit that she felt on the inside. And this is what brought her to see me. When we look at her carefully, you notice that in addition, there's some changes in volume, which is present in just about every case of a person who's aging. You notice that there's a loss of volume around the eyes, the temples, around the mouth, the lip. But as Lizette is older than our previous case study, you notice that there's some additional changes that are happening simultaneously. For example, you can see that the distance between her upper lip and her nose has gotten a little bit longer. This has created a thinness of her upper lip and just a kind of a droopy mouth area. And a lot of people define this as a change in their smile, but a loss of feminine quality to their mouth and the perkiness to the lips. Looking around her eyes, you can see that there's a hollowing around her lower eyelids and her temple region. And looking at her upper eyelid, you can see that there is some heaviness that is formed from extra skin. And this condition is called dermatoclasis. It's something that happens with aging, and this creates the hooding or heaviness that we see in the eyelids. So taking all of these changes together, you can really appreciate the need for a vertical restore to reestablish facial shape. This addresses the neck, the jawline, brings the midface back up into position, as well as lifting the lateral brow. And treating all four of these areas together creates a very seamless and beautiful continuity of the overall facial shape, and you can see that on the different views. When you look at her eyes, you can see that there is a rejuvenation resulting from the combination of fat transfer around the eyes as well as the upper blepharoplasty. And the fat transfer was also placed along the chin and jawline area, which created a much more smooth look. And when you look at her mouth, you can see postoperatively she has a very youthful and beautiful mouth with lips that are much more rejuvenated due to a combination of upper lip lift that was performed to shorten the distance between her nose and her lip, creating a better proportion, but also adding volume in the way of fat transfer to that region. And when you look specifically on her profile at the neck and chin relationship, you can see what a tremendous difference the vertical restore made on profile, giving her an actual neckline and jawline and getting rid of that ptotic or droopy chin that was creating a very old look to her profile view. And now she stands confident, beautiful, totally natural, without any signs of aging. And you look carefully at her incisions, you can barely make out any incisional lines, and the anatomy of her ear is completely intact and normal looking, which is an incredibly important part of ultimately looking natural postoperatively. Also, equally important, now that we have her facial shape back in order and fully restored, we have Lizette on the Karam MD trifecta in order to keep her skin from aging by the use of the 20 plus active ingredients like retinol, vitamin C, growth factors, niacinamide, etc. You can see that her skin is starting to become more bright, more fresh looking, and over time will resist the changes of aging. And using this consistently with sunscreen becomes her long-term anti-aging program. No more needs for fillers, no more need for any other cosmetic laser procedures other than potentially some very specific things directed at specific problems. But her basic maintenance now is just to enjoy life, protect her skin from the sun, and use the right active ingredients on her skin. Beautiful change. Very happy for our patient, Lizette. All right, so our next patient is Cecilia. She's in her 60s. She's a beautiful spirit. She's a beautiful woman, both inside and out. And when she came to me, she had primary concerns of no longer looking the way she felt. And this is a common theme. She felt that she looked tired, she looked sad, she became more unrecognizable. And the fact that she's an extremely active, healthy woman, she didn't want to face the world with a face that didn't resemble who she is and who she felt like she was. So when I began to assess Cecilia, I look at these changes in a very systematic way. I look at skin, I look at volume, and I look at the facial sagging or the facial shape. And so when looking at her skin, overall, her skin, although is supple, and doesn't have a lot of lines and wrinkles, it does have a quality of thinning, it has a dullness to it, and there's some discoloration. And when you look at her facial volume, you notice that under her eyes, above her eyes, her temples, and around her mouth, that she's lost some fullness. You can appreciate this both on the front view as well as the 3/4 view. And you can really see how the interplay between volume affects these different angles. But on the 3/4 view specifically, when you look at this, volume makes her eyes look hollow, but you can also see how there's specific areas of loss around the corners of her mouth, as well as along the jawline, what we call the prejowl sulcus. And on the front view, when you look at this, you can see that there is an indentation at the level of her temple, and the hollows, darkened circles under her eyes, and thinning of the lip. Now, going back to the 3/4 view, you can really appreciate the changes in facial shape, and you can almost imagine and really see how the soft tissues have glided downward towards her mouth, starting at the level of her temple, going down to her midface, going down to her jaw, and affecting her neck. There is a sliding effect that occurs of these soft tissues. And when you look at this now on the front view, you can see the quality that it creates is a face that looks more square or more rectangular, and no longer having that V-shaped jawline or that heart-shaped overall facial shape that is so important to a youthful look. Now, looking at her central face, you can see that there's excess skin on her upper eyelids. There's fat pads and extra skin on her lower eyelids. There's also a increased length of her upper lip, and that's the distance between her nose and the top of her red lip. And this distance creates a very long look to the central face, makes the face look droopy. It changes the smile, changes the overall look of the mouth. And specifically, it creates a thinning upper lip. And the best way to assess this, also in addition to just simple measurement, which the ideal measurement should be around 13 to 15 millimeters, you can also see the relationship with the lips and the teeth, which in this case we cannot assess, but we do in person. So when we take all of these changes together, we have all the different subunits of the face seeing signs of aging. So as a result, the plan is a comprehensive facial rejuvenation, or full facial rejuvenation as we often call it. And that is essentially treating all three of those areas. So for her laxity and sagging and facial shape changes, I recommended a vertical restore, an upper eyelid blepharoplasty, a lower eyelid blepharoplasty, and a lip lift. This is to bring everything back up into position into its natural shape. Then, as far as the volume loss, I recommended a full facial or a comprehensive customized fat transfer to address all the different areas that we see loss. With skin, I recommended the Karam MD trifecta to use twice a day and use it consistently over time. Now, when we look at her before and afters, what we can see is there's a significant, beautiful transformation, and yet she looks completely natural, and that's because there's a seamless quality between all these different areas. But looking at the changes specifically, you can see the facial shape is back into position. The eyes don't have the hollows and the hooding. They don't have the extra skin and that tired look to them. The lips look absolutely gorgeous. There's a fullness to them. There's a shortened distance. The mouth looks more feminine and pretty. And finally, when you look at the skin, you can see there's a radiance and brightness and a glow that is so synonymous with youth, and that is after approximately a year's worth of Karam MD trifecta. So ultimately, a very, very beautiful transformation and totally natural looking, and both Cecilia and I are extremely happy. Our next patient is Judy. Judy is a beautiful, beautiful woman who has lived 70 beautiful years And at this point, she came to me with much of the same concerns as our other patients. However, the changes with aging just continue to progress as you go from the 40s, 50s, 60s, and 70s. And you can really see the progressive changes that we have had an opportunity to look at in the previous patients just manifest in a greater level in Judy's case. But they're fundamentally the same changes. So let's break it down in the same pattern. So we're going to look at skin, we're going to look at volume loss, we're going to look at laxity. And so when we're looking at, in Judy's case, we start with skin, you can see there's pretty significant levels of sun damage, overall thinning of the skin, and a dullness or lack of brightness to the skin. This is from accumulation of just living, genetic aging, as well as sun exposure over the years. So when we look at the volume loss, when we look in the front view, you can really appreciate the hollows around the temporal area, the hollows under the eyes, the hollows in the area beneath her eyebrow or above her eyelids, called it the supraorbital region. You can appreciate some of the loss around her mouth, the chin, even a little bit in the cheek regions. When you look at her laxity or areas of sagging in the same way, you can see that overall on the front view that there is a sliding descent of all of her soft tissues down towards her neck. You can see there's hooding along the corners of her eyebrow. There's a drooping of her midface, creating a hollow sulcus down the center. There's a sagging along her jawline, creating heaviness along her jowls. And then centrally underneath her neck, there's excess fat that's being formed in the center of her neck, as well as loose muscle. And all of this creates a kind of turkey waddle or heaviness down the central neck. And when you look at Judy on the 3/4 and profile view, you can see these changes even more clearly, how it affects the contour of her neck and ultimately how it changes the shape of her face. When we look at her eyes, you can see that the excess skin affecting her upper eyelids and the puffy bags and excess skin affecting her lower eyelids. And this is very important because these changes, along with volume loss, create a very tired look around the eyes. And it's important not to miss the opportunity to correct these changes. Another area that you can see that there's been aging changes is the elongation of her upper lip. You can see that the distance between her nose and the top of her lip has gotten longer, and a conservative but meaningful reduction will be ideal in this situation. To address her facial shape, in Judy's case, I recommended the vertical restore to bring up the laxity along her jawline, her midface, her neck, and lateral brow. The vertical restore very aggressively addresses any type of neck configuration. In Judy's case, there was excess fat and loose muscle under her neck, which was addressed with the vertical restore, and all the soft tissues were brought back up into position. Her lower eyelids were addressed with a skin pinch, and her lip length, which was elongated preoperatively, was addressed with a lip lift. The volume loss was addressed with a customized fat transfer. It was used to fill in under her eyes and around her temples, around her mouth and lips. And then her skin was treated with full field erbium YAG laser resurfacing using the Contour TRL. And then subsequently, she was put on the Karam MD trifecta. When we look at her before and afters, you can see what a tremendous difference the repositioning of her soft tissues has made, both on the front view and the profile views. You can really appreciate the improvement in her facial shape, her improvement in her neck, and an overall much more youthful look. The upper lip lift gave her a fuller upper lip and also a better proportion, which is such an important part of looking young around the mouth. And I think it's like the icing on the cake that gives the overall mouth a much more youthful look. The skin around her eyes look so much cleaner with the excess skin being removed. And finally, you can see that there's so much more clarity and brightness to her skin as the laser resurfacing took away a lot of the pigmentation and dead skin cells, and now she is maintaining these changes with the Karam MD trifecta. No more need for repeat laser resurfacing at this point, but the pigment reducing substances in the Karam MD, in addition to the exfoliating components like retinol, vitamin C, etc., will keep her skin performing and getting better as time goes on. on. Beautiful, beautiful transformation. Judy looks completely natural in all views. She's extremely happy with her overall outcome, as we are as well. Important to point out that, as a final note, that all of these changes are happening on a continuum, and the changes between Nicole, Lizette, and Cecilia and Judy are all a continuum of facial aging changes that happen with time, and that addressing these changes early is obviously ideal because it essentially preserves and prevents future aging from happening in its most dramatic way. And as we can see there, that no matter what age that you do treat it, you can still make a substantial improvement. However, it's beneficial to treat it early to avoid these changes from actually happening in the first place.
All right, folks, I hope you enjoyed that tour, the beautiful changes that you were able to see and the lives that were touched as a result of vertical restore and full facial rejuvenation. My promise to all my patients is consistency, safety, looking totally natural, and achieving results that are reliable and effective. Gaining my patients' trust and giving them the results that they're hoping to achieve is the inspiration and the driving force for me every single day. Follow along for videos like this and a number of other topics like skincare, as well as facial rejuvenation through our skin school and weekly videos. And we also post a short every single week. Additionally, if you want to stay on and watch more videos on the topics and get a little bit more in depth, there's a number of videos that we have made on facial rejuvenation and vertical restore and eye rejuvenation, in addition to a number of other individual patient journeys that you can go into greater depth and learn even more about them. If you haven't already, make sure you hit subscribe, like it if you enjoyed what you've seen, and share it with some friends and family. Let them see what is possible. And for any questions or comments that you have, I would love to see them in the comment section below. I will do my absolute best to address them and interact with you guys. All right, everyone, I hope you enjoyed this. Thanks so much, Dr. Amir Karam.